It has impacts on several levels. The first level is what we call the public health impact. By introducing this low sodium salt into your habits, what we have achieved is an entire distribution of blood pressure in the community. By shifting the distribution, you shift the population mean. And those, in terms of public health gains, have enormous implications, because it has been demonstrated that reductions in blood pressure, systolic blood pressure, as little as 2 millimeters of mercury, translate into lower stroke mortality and lower ischemic heart disease mortality. So that's a huge public health impact. The other impact is that by shifting that, less people have transitioned towards the status of hypertension. The results of studies show a reduction of 55%, so halving the incidence of hypertension. And this certainly has meaningful, not only meaningful, important clinical implications, but also health system implications. Clinical, because less people will need to see a doctor, and certainly so for the health system, less people will require healthcare. By using this pragmatic strategy, we have demonstrated that it's effective, that is, the uptake has been achieved, and that people engage with it. And we can demonstrate that people do engage with it because we also had a sub-study, a subsample of participants, where we collected 24-hour urine samples. In there, we tested for sodium and potassium concentration, and we see that the potassium increases over time. So people actually use it, got engaged with it. So what does it mean? It means that by shifting the entire distribution, we also see larger effects in people at high risk. And those are, who are they? Older people, older populations, and people who have hypertension at baseline. So the effect of shifting the distribution means that the shift in these groups are also higher. The reductions in these groups are much higher than in the overall. What does it mean for low and middle income countries? It means that we have weak health systems, weak infrastructures, weak human resources. Everything is a problem every day. So by introducing this strategy, we can alleviate enormously the needs and the request for the health system to deliver more care. This is hugely important for LMICs because of costs, because of preventing people not taking medication for so long. I mean, we're saving those years of medication. And also because we need to start changes that are community-wide, changes that will enter and sustain over time. And with this, we're demonstrating that the benefits are both population, but also individual and clinical. These two combined are powerful.